Folks, welcome to our second special episode of Real Health with Karl Henry in association with Laya Healthcare. I'm delighted to be joined by Minister for Health, Simon Harris, to chat all things coronavirus. Minister Harris, thank you so much for joining us. How's it going? How are you?
Thanks a million, Karl. I'm good, thank you. How are you?
I'm good. I want to start by asking you something that I suppose no one's really asked you yet in any interview that I've seen, which is how are you? And how are you holding up?
I'm okay. I suppose, like a lot of people working really hard at this time, I'm getting an awful lot of energy and motivation from the incredible efforts of people in the health service, people I'm working with day in, day out in the Department of Health, and actually just being really honest, the Irish people in general, because, there's been a number of times in the last couple of days I've had to make an appeal to people to do certain things, to help out, to sign up, to volunteer. And, I'm just bowled over by the amount of people saying, yeah, I'm putting my hand up. I want to help. How do I help? How do I help? So whilst we're all working, ridiculously long hours, and this is the most intense thing I've ever been involved in my life. And I've been health minister for 4 years. I've seen a lot in terms of intensity and crises, but never something on the scale, on simply the scale of this, something that is all consuming. Everybody's talking about it on a constant basis. No one knew what the coronavirus was a couple of weeks ago, and now people are talking about it day in, day out. So the intensity of that is incredible. The fact that I genuinely know if we get things right in the next few days and weeks, and I don't mean the government, I mean we the people get things right in the next few days and weeks, we will save thousands of lives. I mean, that is a massive responsibility that I feel, that we should all feel. But like I say, I'm balancing that with the kind of just generosity and decency of everyday people who are contacting us and saying, we want to help. And that's keeping me going.
One thing I've been really impressed with from following your social media is you brought almost a sense of humour to some of the posts over the last couple of days, and a real sense of positivity. How are you managing to do that with all the pressure that you're under?
And my team tell me I'm not very funny anyway, but but I mean, I just think it's so important that we keep going as a country. I think one of the biggest risks to us as a country during this is that we let this get us down as a people. So this is going to be extraordinarily difficult. We're asking people to do things that just aren't natural, to keep apart from each other. We're asking families to have the kids home from school, not for a day or two during the snow, but for potentially weeks and weeks and weeks. People are losing their jobs. This is massive pressure on people. And I just think throughout that, we need to try insofar as we can. We're all human. We'll all have bad moments, but try insofar as we can to kind of keep all our spirits going. And that is, I think, our best chance of getting through this as a people. I mean, that's what we do as Irish people. They talk about the mehel, the sense of community and positivity. And I suppose I'm just any little role I can play in that, as well as, pumping out the serious messages I have to. I'm just trying to do that. And, there've been so many people sending me tweets and DMs and Instagram posts and stuff showing me what they're trying to do to help mind an older person in the community. Keep an eye on a family member, and I'm just trying to use my platforms, I suppose, to showcase that in the hope that it kind of motivates us all.
And I know, similar to myself, you have a young baby at home. They were born on the same day. And are you getting home? Are you getting home at all over the course of the last week or two?
Yeah, I mean that's the toughest thing really. Is the kind of normal life as we knew it is somewhat suspended. But look, we're all doing this for our kids, and we're doing it for our families, and we're doing it for our futures. So I don't want to make this about me, because I mean, so many doctors, nurses, Gardaí, Defence Force people in my own department, they're getting up at God knows what time and getting a few hours sleep in the evening and then going and doing it all again tomorrow. And I'm just happy to be part of that army,
Do you think the message is sinking in around the country? I've been watching you. I've been watching the government. I'm watching the news. I'm hooked, unfortunately, to my phone, watching the news all the time for the updates. Yeah. And do you think the country's getting the message?
I think it's really trying. I think people are washing their hands in the way that they've never washed them before. We're having conversations about what song you should sing, the length of time to wash your hands. Happy birthday twice, but people are getting a bit bored of that, so more creative things to do. I think people are getting the cough etiquette right. I see people now actively coughing into their elbow and that's really good. I'm worried about the social distancing, Karl. I think people kind of see this as a discretionary extra or a nice to do, and it's not. Like, there is a public health reason why we're all being asked to do something that's so counterintuitive, to stay apart, that the best way the country can come together is to stay apart. And there's a reason that Tony Holohan, our chief medical officer, and others are saying, will you please keep your distance? Will you please stay 2 meters apart from each other as much as is humanly possible? And unfortunately, as I go about my life and, drive through the city and go back to my own town and stuff, you still see people kind of congregating in large groups. You still do see some teenagers thinking this is just like the summer holidays. It's not. I met some of our most senior doctors there on St. Patrick's Day, and one of them said to me, she's an intensive care specialist, and she said, doctors can save hundreds of lives during this crisis, but she said the people can save tens of thousands. And isn't that an amazingly powerful thing to know, that literally by washing our hands right, keeping our distance and coughing properly, we can help keep people alive in our country. So my big appeal to people is to get that social distancing right. Keep distance between yourself. This is not a time because you're off school or off college to up your social life. It's actually a time to scale it back. Now, I'm sure we'll get onto this in a minute. There are things we can all do to keep in touch and mind ourselves, and that's really important too. But I just can't emphasize that enough. So my appeal going into this weekend is please, please, please redouble your efforts in terms of the social distancing. And I'm tweeting and pushing out on Instagram and stuff exactly what that looks like. But roughly speaking, it's 2 meters between you and other people.
Yeah, I think that the press conferences have been fantastic and how they've been laid out with the big yellow 2 meter gaps.
Yeah.
They've been really, really visually really impressive, and it's hammering it home because everyone's watching it, and it's been a really important way of showing people. And the supermarkets are now following suit, I think, with the distance markers themselves.
Exactly.
The fact that you're traveling around a huge amount, you're in studios, you're in recording, you're in government, you're in the Dáil. Are you concerned yourself about catching it?
We got to be realistic. An awful lot of people in this country are going to get the coronavirus. It's possible a majority of us in this country could get the coronavirus. But for most of us, it'll be a mild illness. And we'll get it and we'll be bunged up at home and taking our paracetamol and taking our fluids and minding ourselves for a few days. So I'm not particularly concerned. It's a reality that any of us could. I'm much more concerned that I'd get it or you'd get it, or somebody watching this podcast would get it and pass it on to somebody vulnerable, pass it on to an older person in the community. So I suppose the responsibility that I have as a citizen is the same as the one we all have, which is to try and make sure I don't get it so that I don't give it to somebody else. Because, people of our age in general, we may well get it. Generally speaking, and there's exceptions to every rule, we're likely to recover well. Obviously, if somebody of an older age and maybe or indeed somebody with an underlying health condition was to get it, that's a much more difficult situation for them. So, yeah, I'm conscious as I go about my own daily life, and conscious that by virtue of the fact that I have to keep going, I'm coming into contact with people. But I'm trying to do my bit in terms of the social distancing as well.
One of the key things that I think has been really impressive so far, and I've no affiliation to any government party, I'm non-political in that regard, but it's been obviously on Taoiseach's address to the nation. I think it was really powerful. It really got people together. Are we likely to see more addresses like that from maybe on Taoiseach, but also from yourself in the coming weeks?
I'm loving this working from home in real time, where you can see Alex beginning to wake. We're. I mean, the Taoiseach did a super job last night. He sorry, he didn't. Wasn't last night. All the days have rolled into one.
That's okay. Yeah, it's all right.
In recent days, when he addressed the nation, and I think he did exactly what people. He told them the truth, but he also told them we're going to work together to get through this. No one will be left alone, and we will prevail. It mightn't seem like it today, and it mightn't seem like it in a couple of weeks' time, but we're going to get through this, and we're going to be a great country again at the end of it too. But I think I have to be really fair here, because I am a politician. When it comes to this, I'm not in any way party political either. I've seen extraordinary leadership from people right across the political divide. Like, there is no time for kind of petty party politics in this. And I'm really grateful for the support from not just government colleagues, but also the opposition. Everybody's really kind of putting their shoulder to the wheel. And I think that's what people expect. And I think the other thing they expect from us as politicians is not to pretend we're doctors. So, this is a public health crisis. We have to make our decisions not based on, what I think when I get up in the morning, but based on what I'm hearing from the World Health Organization, from the European Centre for Disease Prevention, from Dr. Tony Holohan, our Chief Medical Officer. So I want people here to know that, yeah, politicians are going to do our bit to try and provide leadership and to take decisions that need to be taken, but we're going to take them based on really, really good public health advice.
One of the key things facing people around the country, I think, will be mental health, and that's going to become increasingly important over the course of the next couple of weeks. Would you agree?
Yeah, I'm worried about this. I was talking in the Dáil yesterday on the emergency legislation we're bringing in, and I mean, I was just referring to the fact that I think there's a real sense of both individual and national anxiety, right? People are nervous, and I get that. We're all nervous. This is a virus we don't know a lot about. It's only known to the world for about 15 weeks. We're all being asked to live our lives in different ways. And on top of that, let's be really honest, there's economic consequences to this too, at least in the short term. You know, I had to make a decision with the publicans there on last Sunday to close pubs. The moment we made that decision, and it was the right decision, but the moment we made that decision, that put about 50,000 people out of their jobs, at least temporarily. So everybody, there is this collective national anxiety. I just want to be, and like you're brilliant at this sort of stuff. I just want to make sure that we don't just look after people from the coronavirus here, but that we actually try and mind the well-being of people. And what I hope we see in the coming days and weeks are all of us trying to promote and support initiatives to help us keep our head during this too. It's perfectly acceptable. In fact, it's a good idea to get out and take a walk. Do your social distancing. Don't go to a big crowded place, but get out, get a bit of exercise. You know, there are things that we can probably do at home that maybe we've been too busy going out socializing at the weekends before. Read a book, you know, declutter the attic, you know, things that we put off around the house. Keep busy. And I think that is important because, you know, we're human beings. We have a mental health and a physical health, and one feeds into the other. So I am genuinely worried at the moment. And, you know, I want people to know, because I believe this to be true, as a country, we're not going to leave anyone alone during this. We're going to ask people to do really difficult things, and we already are. But we're going to look out for each other, and we're going to support each other. And quite frankly, I think that's the only way we get through this.
The emergency legislation, was it badly needed?
It was, but it shouldn't be seen as a scary thing, right? So I've asked people to cancel events, parades, matches, and everybody's complied. Everyone's gone along with it because people are genuinely putting the interests of their families and their communities first, and I thank them for that. But we need to make sure that if we did need to, say, close down that event or stop this, that we have the ability to do that. And we need to make sure that if somebody has the virus, that we can make sure they can isolate. Now, obviously, if somebody gets sick, they're going to want medical help. But this has never happened before. But if there's a peculiar situation where somebody has the virus and won't isolate, we have to be able to make sure that they do. So I don't think it should be seen as a kind of scary thing, but rather just making sure we all have the powers to keep each other safe. It is about saving lives.
I think one thing people will have taken from the speech earlier in the week by on Taoiseach is the surge and the concerns around that. 15,000 possible cases by the end of the month. How can people, I suppose, prepare for that, if that's the right word or the right terminology?
Yeah, so I think the first thing to remember is we're not powerless in this, because I think when we talk about global pandemics, big numbers, we can all at an individual level, and I get this, we can all kind of feel powerless. This is inevitable. This is going to happen. So what is inevitable is lots of people in Ireland are going to get the coronavirus. That's inevitable. But the overwhelming majority of people who get it are going to recover really well and not need hospital care. Some people, though, will need to go to hospital, and some people will need critical care, and sadly, some people will pass away. If we want to limit those numbers of people who pass away, limit the numbers of people who end up in hospital, it's back to our earlier conversation. We all have a role to play in terms of the social distancing. So I can't tell people, because I've no interest in telling people anything other than the truth here. The numbers are going to rise, and they're going to rise, and they're going to rise. And we're going to probably see by the end of this weekend, well over 1,000 people in Ireland with the coronavirus. And by the following weekend, we'll see several thousand people. But that's only one figure, because most of us who get the coronavirus will be okay. The figure we need to watch is how many end up in hospital and how many end up in the ICU. That's the job we all have to do. Keep your mum or your dad safe. Keep your granny or your granddad safe. Keep vulnerable people in the community safe. And the health service is doing a huge amount to prepare. No health service in the world can be ready for this if the peak comes at the wrong time. So that's why we've got to help them. But we're hiring extra staff. We launched this thing asking anybody who maybe was a nurse, a doctor, a healthcare professional, or just has another skill set to go on to hse.ie/on-call to be on call for Ireland. The first couple of hours, we had 12,000 people sign up, 24,000 people at the end of the first day, 40,000 people yesterday. We're hearing of the 24 Irish doctors from Perth getting on a plane and coming back to work for Ireland and to help us. The GP from Toronto who contacted me yesterday to say, I'm coming home, I want to help my country. So people are doing phenomenal work. And we're working with the private hospitals because there can't be any public-private in relation to this. We need every bed we can get. We're trying to buy more ventilators. We're trying to make sure that people who traditionally have to go to the hospital can now be maybe treated in the community. We're testing as much as we possibly can for this virus. And I got to be honest with people, that's going to mean you're going to wait a number of days. because we've got to test as many people as is appropriate to do so, to find as much of this virus, because the more we find, the more we can isolate, the more we can talk to other people who might have been in contact with it. So I can just assure people a massive amount of work is going on here. There's no limit in terms of the resources that the health service can have. But to be honest, that is somewhat small fish compared to the role you can play, because you, the citizen, you, the family, you, the community, can actually help decide more than I can as health minister whether or not we can flatten back curve.
And we've seen, I suppose, Croke Park was the beacon for, the new testing centres and drive-through testing centres. Are we going to see a lot more of them around the country?
We are. We're going to see 30 of them around the country. So Croke Park obviously probably being the biggest one for obvious reasons. There's also ones open in the grounds of hospitals. There's a Garda station, an old Garda station being used. So a lot of facilities. We'll have 30 of them open in the coming days. I think there's about 20 something open as of today. And that's up until recently, the ambulance service used to go to your house and do the test. They did amazing work. But the scale now is so large, we need dedicated testing centres. So we'll have 30 of them open very shortly.
Okay. And finally, I suppose, this is going to be a time you'll never forget.
That is true.
And I would imagine you're proud to be in the position that you're in and to be leading the country through uncharted waters.
Yeah, look, I feel a huge sense of responsibility here. But I'm conscious that I'm working as a cog in a wheel full of amazing people who are so dedicated. And I'm proud to be Irish. I mean, this is going to be a really, really difficult time. But we are going to get through this by working together and by supporting each other. And I just want to thank the Chief Medical Officer, Dr. Tony Houlihan. I want to thank his incredible team. I mean, people are making so many amazing sacrifices here. And when we look back on this as a country, I want us to be able to say, do you remember that time in 2020 when that awful virus came to our country and we worked together and we made sure that we could actually save lives? And that's really what this is about. But if I can respectfully say, it's a great time for you and the work you do. You know there's a big role to play in this as well, in helping kind of protect our mental health. You know how much our physical health is linked to our mental health and vice versa. And I think anything we can do to use our own platforms to try and keep people well, encourage people, as you always do, to get up off the couch during the ad break. Like, let's make sure that we don't just protect people from the coronavirus, but that we actually all try to keep healthy and well, and let's all work together on that.
Minister for Health Simon Harris, on behalf of myself, my team here at Real Health, and all the team who work on the show with us, and all of our listeners, and my own family as well. You heard Alex interrupt us earlier on. My apologies. This is uncharted waters. Daddy daycare and podcasting at the same time. But honestly, you and I don't really know each other. I've chatted to you before. We've met once or twice. I've been blown away by the strength and the real sense of communication that yourself and all your government colleagues have shown. I think it's crucial over the course of the coming weeks to have that leadership in place. And when you look all around the world at other countries who have this problem, they don't have the leadership or the communication that we have in Ireland. I think we're very, very lucky to have it. And I thank you genuinely on behalf of all our team and myself and our listeners for that. And thank you so much for talking to us. This will go out and help so many people. The key message from what we're chatting about very much is personal responsibility. The more personal responsibility we take, the safer and healthier we're going to be as a nation. Have a wonderful day. Do keep minding yourself.
Thanks, Karl.
And, try and get some sleep as well, as much as you possibly can. But thank you so much for everything. Minister Simon Harris, thank you so much. Slán Karl.
Bye.
Laya Healthcare, looking after you always. Proud sponsors of Real Health with Karl Henry.